To address the overlapping objectives of the corrections and behavioral health fields, the Council of State Governments Justice Center has developed a shared framework for supervision and treatment, incorporating criminogenic risk and behavioral health needs. This framework was developed in partnership with the National Institute of Corrections, the U.S. Department of Justice's Bureau of Justice Assistance, and other leading organizations in behavioral health and criminal justice. The following presentation provides an overview of an important conceptual tool from that framework, which can help behavioral health, corrections, and community corrections agencies identify people with behavioral health needs at various points in the criminal justice system. It helps practitioners focus on those persons with high criminogenic risk and behavioral health needs, and then develop a collaborative and comprehensive case planning process for their effective reentry into the community. This framework graphic looks at three dimensions: criminogenic risk, need for substance use disorder treatment, and need for mental health treatment. Initially, the framework was designed as a systems planning tool to assist corrections and behavioral health agencies to match groups of people to appropriate interventions. When it is used at the direct service level, it can also guide decision-making for screening and assessment practices, as well as matching resources to level of risk and behavioral health need, and it can assist agencies in the development of an effective case planning process. Ideally, the first step in matching people to services is to conduct an assessment for criminogenic risk. The results of this assessment will identify which individuals have low criminogenic risk and which individuals have medium or high criminogenic risk. For systems with limited resources for reentry programming, targeting people who have medium or high criminogenic risk is the most cost-effective way to advance their goal of reducing recidivism. The second step in matching people to services is to determine which people with medium to high criminogenic risk have substance use service needs and the severity of those needs. This step can be accomplished by using validated screening and assessment instruments to identify the presence and severity of substance use disorders. The primary reason why substance use is the second step in this framework is because substance use is one of the core criminogenic risk factors, while mental illness is a responsivity factor. Substance use disorders are also more prevalent than other behavioral health disorders among people who are incarcerated. The third step in matching people to services is to determine which people have any mental illnesses and the severity of their illness. Just as with substance use, the presence and severity of mental illnesses can be identified by using validated screening tools, followed by clinical assessment as necessary. The presence of a mental illness or of a serious mental illness is an important responsivity factor that should be addressed in a person's treatment and supervision. It is important to remember that even though mental illness is not a central criminogenic risk factor and is not a predictor of criminal behavior, the research indicates that many people with mental illnesses in the criminal justice system also have several of the criminogenic risk factors. It's also important to remember that many of the same people have high rates of co-occurring substance use disorders, which can contribute to their relatively higher risk scores. Plus, mental illness can often cause functional impairments that can significantly impact a person's responsivity or how well they benefit from the intervention to reduce their criminogenic risk. If your agency does not conduct assessments for any of these three domains, criminogenic risk, substance use disorder, or mental illness, consider obtaining this information from another agency that is also working with the person. For example, if you are a behavioral health treatment provider and you do not administer a criminogenic risk assessment, consider partnering with the criminal justice agency who is working with your client who is under correctional custody or community supervision in order to set up the appropriate information sharing protocols to get this information. After assessing for criminogenic risk, substance use, and mental illness, people can be matched to the appropriate programming to address their criminogenic risk and behavioral health needs. People in groups 6 through 8 have medium to high criminogenic risk and medium to high behavioral health needs. Ideally, people in these groups should be targeted for reentry programming because the potential for recidivism reduction and successful recovery is greatest when agencies focus their resources on higher risk and higher need populations. While people with lower criminogenic risk should not be ignored, Focusing on the higher risk and higher need people reentering the community achieves the greatest potential impact on recidivism. On the other hand, intensive supervision interventions alone for people who are at low risk of recidivism will do little to change the person's likelihood of recidivating and may even be harmful. For example, low-risk people who are placed in a close supervision-only program may be more likely to be sanctioned for a violation of the terms of their supervision, especially if they are placed with high-risk individuals who encourage antisocial behavior. Therefore, high-intensity programming or supervision for people at low risk of recidivating is an ineffective use of resources to reduce reoffending. If you are assisting people who have low criminogenic risk, but medium to high behavioral health needs, they may be good candidates for referral to community-based substance use disorder and mental health treatment, potentially through early diversion to limit further involvement with the criminal justice system. Finally, to develop a collaborative, comprehensive case plan, one must gather the results from all of the assessed domains. By utilizing these results to develop the intervention plan, systems can better ensure the goals of the case plan are balanced to effectively respond to any existing criminogenic, substance use, and mental health needs.